Welcome to my YouTube channel. Thanks for the subscriptions. To all those who subscribed yet, those ones who have not yet subscribed, please subscribe, put on a notification, and continue to learn. Today we are going to look at a common how can I call it, hemorrhagic disease, which affects women mostly. It is very common in women of reproductive age, and once the women reach this stage of reproductive age, most of them, the biggest number of them, get this problem. And this problem is what we call ovarian cysts. Cysts are just capsules which are filled with fluid, and they are found in the ovary. They can be found in the round ligament. That ligament connects the ovary to the uterus. There is a broad ligament and a round ligament. So more so in the broad ligament, we can find these cysts. We can find them in the ovaries. We can find them attached on each ovum, attached a cyst. There are of varying sizes. There are those ones which are small. They can be in dimensions like 1.2 to 1.21 centimeters, and there are those ones which grow and they become big and massive. They are of two types, one of which is what we call the functional cysts, and another type is the non-functional cysts or the pathological cysts. When we are beginning with the functional cysts, these ones are there in every woman of reproductive age, and as the name, functional cysts, they are going to be aiding this woman to have their menstrual cycle going on well, and their menstrual bleeding to be okay without any controversies, and they are produced once the woman reaches ovulation. So when we look at the second category, the second type, that is now the non-functional one, or the one we are going to refer to as the pathological one. This one is brought about by different conditions. We can have one which is filled with blood, which we call hemorrhagic capsulotum. It's going to be filled with blood. Others, they just accumulate the fluid and they become big in size. It becomes big. You see a woman having a swelling abdomen as if they are pregnant, but only find out it's only the cyst which is just bringing these issues. These others can be affected by what we call infections. They can be infected. It inflames, it becomes big and more painful. They can lead to some women to start bleeding. They get bleeding from down there in their VJs. They bleed like nothing. When the bleeding is not due to their menstruation, but the bleeding is due to the cyst they are having. So how do we treat these cysts? For small cysts, which we refer to as functional cysts, they go away on their own. They be there for some time, and when time reaches, they just disappear. They dry out and disappear on their own. All others which fail to disappear by themselves, we treat them using antibiotics. We can put the patient on an antibiotic therapy, can give them drugs like secnidazole, can give them metro, which is we can give them like clotrimazole. We give them clotrimazole cream, they apply it down there, prevent infections from going up and affect the cysts, because the cysts are directly attached to the uterus and the ovary. So we give them clotrimazole to prevent the infections from moving from down to go up. We can give them cefixime to dry out the cysts. We can give them azithromycin. Those drugs can help them dry out this. So once these drugs fail, the drug therapy fails, you have given the drug, the cyst is not going away, it is becoming big in size. What we do, we do what we call a surgery. We open the patient, we do what we call a cystectomy. We open the patient, we remove the cyst by surgery. We open, we cut, we remove it, then we close the patient. That's how we do with these cysts. They are not so dangerous as you can see, but once they jump from the normal limit, they can become a threatening factor, fertility, and other related issues. So always, when you feel abdominal pain, go to your doctor, go and do an ultrasound scan to rule out whether you have a cyst or not. Functional cysts, which are small in size, they will disappear on their own. The non-functional cysts, which we also refer to as pathological, we treat them by giving antibiotics and some UTI drugs to prevent the infection from going up there and getting contact with these cysts, because it can also lead to injury to your uterus and the ovary. When those ones fail, we do an invasive procedure, that is doing a cystectomy, open you and remove the cysts by surgery. So